St. John's wort side effects. St. John's wort is a herbal supplement that has been used for thousands of years in the treatment of mental health problems. It is used today mainly to help combat depression, anxiety, sleep problems, and seasonal affective disorder. While many people have reported great success with this traditional herb, it can come with some serious side effects. In this video, we examine whether St. John's wort is an effective supplement and highlight some of the risks that you must consider if you're thinking about taking it. What is St. John's wort? The botanical name for this ancient herb is Hypericum perforatum. The plant contains the key ingredients, hypericin and hyperforin, which have been used for generations for their supposed antidepressant and calming properties. In addition, the plant contains a host of other substances that may increase its antidepressant activity. However, the action and effectiveness of these substances is not fully understood. How does it work? St. John's wort is thought to work in the same way as regular antidepressant medication. Scientific research into the herb suggests that it has the ability to increase the activity of serotonin and noradrenaline, which are two important brain chemicals. They are thought to play an important role in elevating mood and boosting feelings of calm and tranquility. Is St. John's wort really effective? The evidence here is mixed. Some studies report that patients found St. John's wort useful in helping to control their depression and anxiety. However, other clinical investigations found that users felt very little or no benefits. In 2015, a study published in the Annals of Family Medicine looked at whether St. John's wort was more effective than a placebo for patients being treated for depression. The research looked at 66 previously published studies with more than 15,000 participants and found that both antidepressant medications and St. John's wort were more effective than a placebo for treating mild to moderate depression. One common conclusion of the many studies was that St. John's wort might be a useful treatment for mild depression. However, for severe symptoms of mental health problems, the evidence does not show a strong, clinically significant effect. What are the potential side effects? The side effects of St. John's wort include feeling nauseous, headaches, allergic reactions, dizziness, mental confusion, and skin rashes. However, one of the biggest problems is its serious interactions with a large number of medications that you may already be taking. This dramatically increases chances of adverse effects. For starters, you should never take St. John's wort while taking any other antidepressants. Combining the two could make your depression much worse and lead to a serious condition known as serotonin syndrome. This is an overabundance of the chemical serotonin in the body, which could lead to unconsciousness and even death. St. John's wort has been shown to prolong the effects of sleeping pills and anesthetics, making you drowsy for much longer than normal. The herb also reduces the effectiveness of contraceptives, leading to an increased risk of pregnancy and bleeding. Other medications that are affected by St. John's wort include antipsychotics, which are used to manage severe mental health conditions, anticoagulants, which thin the blood, and immunosuppressants, which help to prevent the body from rejecting transplanted organs. It can also reduce the effectiveness of medications to treat heart disease, high blood pressure, migraines, cancer, HIV, and AIDS. Do not take it if you are pregnant or breastfeeding or have a diagnosis of bipolar disorder. It has been known to cause hypomania, which is a rapid switching from low to a high mood that can place you in danger. If used topically, St. John's wort can result in a skin rash. It can also increase the sensitivity of your skin and eyes to sunlight. If you have a condition such as lupus or are taking drugs that can lead to photosensitivity, such as some acne medications, do not take St. John's wort. Are there any withdrawal symptoms? People who have suddenly stopped taking the supplement have reported feeling sick, dizzy, and tense. As St. John's wort has similar properties to prescribed antidepressants, you need to slowly cut down your dosage to reduce the chances of withdrawal symptoms. What's the bottom line? Although herbal remedies are marketed as natural, they are not free of side effects or always safe. There is limited evidence to support St. John's wort's effectiveness in treating moderate to severe mental health conditions. There are also a range of potential side effects that you could experience. Moreover, there are very serious dangers if you are taking the herb alongside other medications. The best advice is not to self-medicate and always seek the opinion of a qualified doctor before you begin taking St. John's wort.
If you liked this video, please subscribe to Better Days, where we deliver fun and informative videos that help you become the best version of you. Till next time, have a great day.